Hello, and welcome to the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, Board Certified Dermatologist, and I'm here to discuss with you all issues relating to the skin that you're in. In this podcast, we will tackle the topic of the day quickly to get you the take-home points that you need. After listening to an episode, you should be educated about the topic and able to fix the issue yourself or well prepared to ask the right questions at your next dermatology appointment. Let's get started. Today, I would like to talk about skin cancer, the most common types, and the basic treatments for it. Let's start with basal cell carcinoma. Basal cell carcinoma is the most common skin cancer and also the most common cancer of all types in humans, so it is very, very common. Basal cell carcinoma is usually very, very slow growing, and it usually does not spread. However, it can be locally invasive, and it is best to treat it early before it causes any trouble. Squamous cell carcinoma is a bit more aggressive than basal cell carcinoma. These can spread, although it is also somewhat rare. To give a frame of reference, personally, in my 25 years of professional experience in dermatology, I have never seen any patient have a squamous cell or a basal cell carcinoma spread. So it is unusual, although it can happen. There are many different ways to treat these two types of cancers, basal cell and squamous cell. I'm going to group them together for purposes of talking about the treatments, since they are really the same. There is Mohs surgery, spelled M-O-H-S, after Dr. Mohs, who invented it, and it is a special technique and a type of surgery done by a dermatologist in the office as an outpatient, where they cut it out and check the pathology at the same time to make sure that it is all out before closing the wound. Another option is regular surgery, where it gets cut out and the specimen goes to the lab and you find out later whether or not it's all out and the skin gets sewn back together at that time. We also will commonly do something called D&C, or desiccation and curettage, or ED&C, electrodesiccation and curettage, where we will scrape and burn it 3 times in a row in the office, done as an outpatient, a minor surgical procedure. And that is also very effective at getting rid of some of these skin cancers, particularly early stage ones. Another option is chemotherapy cream, such as 5-fluorouracil, otherwise known as Efudex, or imiquimod, otherwise known as Aldara. And the creams are helpful for people who get a lot of skin cancers or who have them in difficult areas that are hard to operate on or who cannot tolerate surgery. The creams are not going to be as good as any of the 3 surgical procedures mentioned, Mohs, regular surgery, or desiccation and curettage, but the creams do have a role for many patients. There is also the option for radiation therapy. This is usually saved for, again, patients who can't tolerate surgery or something that's in an area that's very difficult to operate on, such as the tip of the nose or the shin. And radiation therapy will work well on these skin cancers. It is annoying because you have to go for many treatments, but there is a role for radiation therapy for some skin cancers. I'd like to mention that there is starting to be some laser treatments available, particularly for basal cell carcinoma, and while this is not mainstream or common, it is an area to look out and watch for further developments. I'd like now to move to melanoma, which is the skin cancer that everybody always worries about, and rightly so, because melanoma can be deadly. And it is the most dangerous type of skin cancer as it can spread more easily, but still, if it is caught early, it is completely curable. So melanoma always requires surgery, so the area where there was a melanoma will be cut out with a wide margin, either by a dermatologist or by a general surgeon or a plastic surgeon. Sometimes you can do Mohs surgery for melanoma, particularly if it's on the face, but it is not common. It's usually regular surgery. Sometimes lymph nodes need to be sampled as a sentinel lymph node or a lymph node dissection, depending on what is going on with the particular patient. Sometimes scans are necessary and further workup and seeing an oncologist. The vast majority, this is not the case, just a surgery in the area and it's done. But if it is more advanced, then it requires oncology to be involved. The most common location in men is the back, and women, it's on the leg. The interesting thing about melanoma is that the treatments for advanced disease have made absolutely gigantic progress during my professional lifetime. And previously incurable disease that was a death sentence has become curable in at least 50% of cases. So there are really rapid advances in the treatment of melanoma that is extremely exciting. However, the best thing is still to catch it early before it spreads. I'd like to talk briefly about Merkel cell carcinoma. Merkel cell carcinoma is also a scary skin cancer. However, it is very rare. It is uncommon. It is harder to diagnose because it's a little tricky. Sometimes it's just a little red bump. It's often on the upper trunk of men and women. It's more common in older people. It's usually caught because it's changing and growing, and it grows rapidly. So again, we can refer back to the ABCDEs of skin cancer. If you haven't listened to that podcast, now's a good time to head over there and listen to it. But if you have something that is changing, please call it to your doctor's attention. Merkel cell is treated with a wide excision, sometimes radiation, sometimes immunotherapy. It can be cured if it's caught early enough. These are the most common 4 different types of skin cancer, and they are all related to ultraviolet sunlight exposure. Sometimes there's also a genetic component, and the best way to avoid skin cancer is to avoid sun exposure, since we know that the ultraviolet rays are going to increase your risk of skin cancer. So occasionally people will argue with me over needing UVB for the vitamin D, needing ultraviolet B for, rays from the sun to develop vitamin D. And while that is true, there are many other ways to get vitamin D, such as dietary or taking vitamin D pills. And I will tell people who have a history of skin cancer or a strong family history that I would much rather them have a low vitamin D level and need to take oral vitamin D supplementation than to get ultraviolet B exposure. So certainly if you're concerned, get your vitamin D level checked, but try to keep your skin out of the sun with clothing and sunscreen. If you have not listened to the podcast on sunscreen basics, now would be a good time to also check that out. That is in season 1. So I hope this was helpful to go over the 4 most common types of skin cancer: basal cell, squamous cell, melanoma, and Merkel cell. Basal cell is extremely common, then comes squamous cell, then melanoma, and Merkel cell is pretty rare. All skin cancers are best if they're caught early, so get yourself in for a skin cancer screening as soon as you can. Thank you so much for joining me today on the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, Board Certified Dermatologist. I hope this episode was informative and that you enjoyed listening. If you found this podcast useful, please give us a 5-star rating wherever you get your podcasts. It helps others find us so we can help them too. Just a caveat to remember, this is not medical advice, and please see your dermatologist or doctor for questions pertaining to your specific situation. I look forward to talking with you again in the next episode.